Down Syndrome Australia Inclusive Communication Project. We want to improve healthcare outcomes for people with Down syndrome. Firstly, we would like to acknowledge the Aboriginal lands in which we are meeting on today. We want to pay our respects to elders past, present and emerging. Hi, my name is Olivia and I prefer to be called Liv. I was born in Belfast in Northern Ireland and I am 22 years old and I live in Sydney in New South Wales. I love doing dance, travelling and fashion. I am a health ambassador for DSA and I work at SJP Architects. My job keeps me busy. I have been a model for Tommy Hilfiger clothes. I love to go to footy matches and concerts in the city. This is Natalie and she is the project manager at Down Syndrome Australia. She is a nurse and has a master's public health. Natalie has 4 daughters. This is Henrietta. She's now 17.
Today we want to talk to you about the Down Syndrome Australia Inclusive Communications Project, improving health outcomes for people with Down syndrome. We will look at the project rationale and initiation.
This is why DSA thought it was important to do this project.
The project planning phase.
This is the plan of how DSA will carry out the project.
We will have a look at the execution.
This is how DSA will deliver the project.
And we'll have a look at the performance and the monitoring of the project.
This is how DSA know if we are making a difference.
And then we'll have a look at what happens next. So firstly, let's look at the why. Why Down Syndrome Australia believed and saw the need for this project. Down Syndrome Australia was very much involved in the planning of the National Australian Roadmap, which began in 2019. The inadequacies in the health of people with intellectual disability in Australia are alarming. People with intellectual disability are dying years earlier and experience twice as many preventable deaths compared to the general population. The National Roadmap for Improving the Health of People with Intellectual Disability identifies the need from a disability point of view, an education for healthcare workers point of view, and a government structure point of view. These points have all been taken directly from the National Roadmap.
The need for people with Down syndrome is also great. There are about 15,000 people with Down syndrome in Australia. There are about 290 babies born with Down syndrome born every year in Australia. And the United Nations says that people with disability have the right to equal healthcare just like everyone else.
In 2019, the Australian Institute of Health and Welfare released a report which showed that people with disability have a greater need for health services, but yet have poorer outcomes. In 2018, Melbourne University carried out a survey of community attitudes towards people with intellectual disability. The findings were not surprising, but very interesting. Most people felt unsure about how to act towards someone with disability. They felt that this was due to a lack of familiarity, a lack of positive experiences, and preconceived stereotyping. So what can healthcare workers and professionals do to help overcome these attitude barriers and therefore improve the health outcomes and experiences in our health system for people with intellectual disability? In 2020, we wanted to find out exactly what people with Down syndrome thought. So we surveyed a group of people with Down syndrome and received approximately 85 responses from people with Down syndrome from around Australia about their experiences when they see healthcare workers. And this is what they said.
Take extra time. Include me in the conversations about my health. Take my health issues seriously. Speak clearly. Give me time. Repeat until I understand. Use a communication form. I understand, and maybe use visual supports.
So the why and the need was very clear, both from an education of health professionals point of view and the need of people with Down syndrome. The next step was for Down Syndrome Australia to look at the how we could create change in the health outcomes for people with Down syndrome. In March 2020, Down Syndrome Australia was successful in receiving a government grant to fund the Inclusive Communications Project. The guidelines of the grant fit perfectly with Down Syndrome Australia's desired outcomes, improving skills of people with Down syndrome and improving practice of healthcare workers.
Down Syndrome Australia then employed Natalie, and the project came to life. The project is divided into two parts. The Health Ambassador Program, the creation of resources and online learning tools for health care workers. Today, we will focus on the Health Ambassador Program.
So we now knew what we wanted to do. We just needed to put it into a workable plan. Our first and the most important part of the project was to include, involve, and co-design with people with Down syndrome. We knew that people with Down syndrome had to be the face and they were an integral part of the program. People with Down syndrome working in a position of influence, being paid an award wage to do an extremely important job. We advertised for the Health Ambassador positions. Each applicant had to meet the criteria on the job description. I interviewed all applicants and assessed their applications and interviews on the matrix created around the criteria, which were required to fulfill the position. Down Syndrome Australia employed 10 people with Down syndrome from around Australia.
To get the job, I had to send in a video about why I wanted to be a health ambassador. This is my video. Hello, my name is Olivia Sidhu. I am 21 years old. When I talk with my speech pathologist, she is kind and caring towards me. She respects me and is patient and supportive. I enjoy when we talk about fun things. Then we had an interview with Natalie. Natalie rang me and told me I had the job, and I felt excited, and I can't believe I'm the Health Ambassador for Down Syndrome Australia. I then had to sign the contract. Natalie explained the contract with me. This is a short video about how we all feel about being a health ambassador for Down Syndrome Australia.
I want to be a health ambassador to help people with Down syndrome to improve their health care.
When I was offered the job, I was really honest.
It's all about good communication with people with disabilities.
I want to be a health ambassador because I want to help others. I would like to teach healthcare workers, and I like to be to do people.
I want to be the health ambassador for Down Syndrome Australia so I could help people with Down syndrome and raise a voice for others who has Down syndrome.
I talk to my parents, they talk to me. That's it.
I want to be a health ambassador sharing my ideas.
I want to become a health ambassador because I want to advocate for change. Down syndrome isn't just about what you can see.
That's why I also want to be health ambassador for Down syndrome.
Once we deployed the 10 ambassadors, the next course of action was to set each of the health ambassadors up for success. We wanted them all to feel confident to speak in public and speak from a position of experience.
The first thing we did was have a team meeting on Zoom, so I could meet all the other health ambassadors. I felt that it is so good to meet people from different states. Then we did 8 weeks of online training on how to make speeches and do presentations. We all created our speech about our core message. My core message is I want the healthcare workers to speak to me, and also to make sure to include me in the conversations about my health. We all felt more confident after the training. These are some of the feelings we had before and after the training.
Earlier this year, in March, we launched the Health Ambassador Program at Parliament House in Canberra to an audience of politicians, government officials, key stakeholders, and people with Down syndrome.
Emily delivered her core message to the audience. This is part of her speech.
It is important for health professionals to talk to me and not my support worker. I am a grown woman and I want to be a part of making decisions that affect me.
This is my speech to healthcare workers. Healthcare workers can be better at their job if they listen to me and be kind and always respect others. It is important to stay calm and be kind and have patience. conversations always need to have clear and specific messages and make it simple so we can understand, and how we will have the courage to tell you how we feel.
And now we'll have a look at how they use their speeches and what they actually do.
We are advisors and co-designers of resources with other disability organisations, the Council for Intellectual Disability. We are in the new Australian roadmap for improving the health of people with intellectual disability. We deliver webinars and face-to-face presentations about what inclusive communication is. We show healthcare workers how to include people with intellectual disability in their health conversations. And we explain to them what a positive difference it can make to our health outcomes when they make reasonable adjustments to their practice. This is what we tell them. Give me time. Give me support. Use a language I understand. Use visual supports to help me understand. This helps people with Down syndrome to be an active part of their own health outcomes.
As I said, and as Olivia said earlier, we're also producing resources for people with Down syndrome and their families, like this health screening tool for people with Down syndrome birth to adult. This is a tool for GPs and people with Down syndrome, their families and carers to take to their GP with them and make sure all the health issues are being addressed and appropriate screenings are taking place. The health ambassadors have also been busy working hard to encourage people with intellectual disability to be an active part of their own health.
This is Kim, talking to people with Down syndrome about having a COVID vaccination.
Are you scared having COVID-19 vaccination injection? Hey, that's okay. Nobody really likes having needles.
Finally, let's show you what a difference we are making. I'd like you to look at the performance or the evaluation of the work that the health ambassadors are doing. This is some of the feedback we have received from the presentation so far. I think that this shows exactly what a difference the health ambassadors are making.
There is not one fits all approach. Everyone is different. Respectful language, person first language, clear communication, give individuals the time to speak and process. Identifying the communication style individuals prefer, provide support and smile. This is more of the feedback we receive.
So far, the ambassadors have reached a number of medical students, occupational therapy students, hospital workers, government, and we want to reach more. The grant funds our project until the middle of 2023, and we will continue to influence change in health until then and hopefully beyond. The health ambassadors and I will continue to conduct webinars and give presentations to health workers. And our next big venture is an e-learning package on Down syndrome for all health professionals, which we hope will be completed and online in March 2022.
We want to tell all healthcare workers how they can make a difference and how we can work together. We hope that the government continues to fund this project beyond 2023.
This project is groundbreaking in Australia. It is the first project to tackle health inequalities for people with Down syndrome by employing them to break the cycle of stigma, misinformation, and lack of awareness about intellectual disability and Down syndrome. We have discussed and shown you the rationale, the why we believe this is such an important issue, the plan and the execution of how we are delivering the project, the performance and the feedback that the health ambassadors are currently receiving, and what is and what we want to happen next.
Don't focus on Down syndrome. And look at me and my symptoms as an individual. Try to understand my forms of communications. Thank you for listening to us today. We would really like your feedback. Please scan the QR code to get to our evaluation. We also want to remind you all that the next World Down Syndrome Day Congress is in Brisbane, Australia in 2024. We can't wait to see you all there.